Hi, I'm Brian Moran, founder of Government CIO. Welcome to Government CIO Magazine.
Hi, this is Edson Acevedo with Government CIO Magazine. Today we're with John Teeter, Acting Chief Information Officer of the Department of Health and Human Services.
Well, there's a number of ways. I mean, we're like a lot of departments right now. We've got an innovation program. We've got an awards program. You know, that was one of the major initiatives that the Obama administration came in with, trying to innovate. You know, the way that government behaves, and so we've got those types of things. But also we've got a couple of collaborative efforts that are going on where we look at things within the context of a functional view rather than organizational view. So we bring the best minds together within that particular functional area and task them with coming up with different and innovative approaches to exercising things like, you know, shared services, which is big with the CIO, Steve Van Rokel, right now. Well, that's clearly in the area of implementing health reform, and one of the big things there that we're doing is we're advancing the use of the cloud and reaching out to our partners at the state levels, so that we're actually building the framework that will allow us to be more agile and flexible in the future. We're building component services now, and we're doing that in collaboration with the partners, the people that actually have to support the operations that our grant dollars support and the legislation that came forward. And so they're now at the table, and we're building this together and then sharing it amongst everybody. So now you've got an innovative way of doing things that allow you to build things one time, share them with multiple stakeholders, and reduce the cost accordingly. Performance was key, scalability was key, and the different types of standardization. And when I say standardization, I mean industry standards. So we don't want to be engaged in a proprietary world anymore. We want to make sure that the things that we're putting out there have some portability and some usability across multiple platforms. So, but they have to scale, because the scale of what we do is so big. It's nationwide and in some cases global. And so it has to scale, has to have different types of industry accepted standards, and then the performance of that on both the functional side and on the IT side is really key. Well, we're like a lot of the other folks again, in that we're considering doing things like standing up vendor management offices that actually look across our department. And you know that HHS is made up of a number of large household names like CDC, NIH, FDA, etc. And so those organizations, they tend to reach out and they do their missions in a certain way, and they should. But what we are looking for now is opportunities to leverage the work that is going on at those important organizations and say, can we take a look at this in a commodity way rather than viewing it as an IT initiative? Let's view it as kind of a commodity. And so we've done things already in the area of aggregating our telecom and costs, and we've saved tremendous amount of money there. We're going to be looking at taking an enterprise-wide approach to buying cloud services and hardware and things of that nature to drive costs down and to simplify the acquisition process for everybody across HHS, and that way these commodity things will just be available. Well, so the advent of smartphones and tablets and things of that nature, and you see that across the federal space. Now, our challenge there is to work with industry to make sure that the federal requirements, particularly in the area of security, are met. And so when we work with folks, like one of the big tablets now is the iPad. And so when we work with Apple to say, okay, what is your security model? How does that fit with the federal space? And some of these very innovative ways of doing business in that mobile world, you know, sometimes they have not targeted the federal space. They've been more on the consumer side, and that's where their marketplace was. Now they're recognizing that you know the government have needs that don't exist in the consumer world, and so that's a big deal. You know, other areas that we're looking at are in the mobile area are standing up our own app stores, and so we have not taken any steps to doing that yet, but we see the value in if we're going to have these mobile devices and we're going to do things in the cloud, let's say, then maybe mobility and having an app store that's available for our federal constituency is the way to go. Well, you know, I think that just in social media, you know, it's not so much the technology, it's how you use it, how you think about using it. So one of the things that we've talked about recently is maybe using a social media site to gain the opinions of those folks that we do business with, whether it's in the vendor community, whether it's in the standards community, whether it's in the state and local governments or whatever, having the ability to bring all of that perspective together and synthesize that into an approach that then represents the opinions and perspectives of all of those folks is, I think, going to be a key thing as we move forward in a little bit more of a rapid way and engage in more rapid types of development, because you've got such a quick turnaround to produce the various components in an agile development process, that it really helps to reach out and say, okay, what are the business gotchas that need to be considered within this particular piece of software that we're building, or this process that we're standing up? Because it's not always about IT. I mean, I know that's surprising, but it's not always about IT. IT is an enabler of the business, and so a business process, a good one, is just as important as the IT that supports it. I think just the big push towards services that the new architecture is promoting will not only dramatically change the perspectives on how we do things at HHS, but I believe across the federal space, because a lot of the departments now are starting to take the same approach that we have been considering, and that is to look at things functionally rather than organizationally. And so when you look at things functionally and you offer things up that have been done as a shared service in that functional area, now if you offered all of that as, let's say, open source, then you could offer things in an innovative way to people that are doing the same types of things, but you could also challenge industry to take that work that's already been done and make it better, and they can do that more easily now that it's open source. And so, you know, there's a lot of opportunity in that collaborative shared services area, and I think that'll be one of the biggest things moving forward. I think that probably the biggest innovation that I see on the horizon is not necessarily in the area of technology. There's a lot of technology tools and security tools that will help us do those things at that technical level. But the biggest thing that I see coming down the road is the tagging of data with its security attributes, so that now as data moves across this vast network that we call the internet, now you'll have a way of saying, okay, this is the security that's required to see this piece of data. And if you don't have that security, then you don't even see that the data is there, much less get access to it. And so that's kind of something that's in the works right now. There's a lot of very smart people that are working on that type of security tagging. But there's plenty of work left to do there. But once that's done, then I think that'll revolutionize things. I'm looking for those things that will allow us to buy services rather than build services, and so that's pretty broad, I know. But things like in the health arena, you know, I want to see those services, those innovations that industry is invested in, that help us do the things that we need to do to support healthcare reform, let's say, or the push out and the effective use, the meaningful use of electronic health records. Right now, we're trying to develop the standards and the capabilities of doing things in an innovative way in those areas, but that's what I'd like to see. I'd like to see innovation on the industry side that would offer those services as a commodity, if you will, to the government, so that the government doesn't have to invest so much on the capital side of the equation, but they can actually buy things on the operational side of the financial equation.